3 of the 5 medications I'm about to share with you require no prescription. You can walk into any pharmacy right now and buy them off the shelf. That is exactly what makes them so dangerous for anyone over 70. Because when something is easy to get, we stop treating it like a drug. We treat it like it's harmless. And for a body that has crossed the threshold of 70, that assumption can mean the difference between independence and a hospital bed. Here is something most doctors don't explain clearly enough during a 15-minute appointment. The human body processes medications in a fundamentally different way after 70. Your kidneys filter drugs out of your bloodstream more slowly. Your liver metabolizes compounds at a fraction of the rate it managed 20 years ago. Your brain becomes dramatically more sensitive to sedatives and anticholinergic compounds. A dose that was safe for you at 55 can now cause falls, memory impairment, kidney damage, and cognitive decline that gets mistaken for early Alzheimer's. Today I'm covering 5 specific medications that illustrate this problem more clearly than any others. All 5 appear on the American Geriatric Society's Beers criteria, the medically reviewed, regularly updated list of drugs considered potentially inappropriate for older adults. This isn't fringe medicine. It is mainstream geriatrics finally reaching the people who need it most. I'm Dr. Sarah Mitchell, and this channel is dedicated to translating current research into practical, actionable information for adults over 60. If you haven't subscribed yet, please do. We publish new evidence-based content every week designed specifically for you. Now let's get into these 5 medications, and more importantly, what to do if you or someone you love is currently taking any of them. The first category is benzodiazepines. You probably recognize the brand names more than the drug class: Xanax, Valium, Ativan, Klonopin. These are prescribed primarily for anxiety and insomnia. They do work in the short term. That effectiveness is part of why they're so widely used, and part of why they're so consistently problematic for older adults. After 70, the brain's sensitivity to benzodiazepines changes significantly. Because the liver metabolizes these drugs more slowly, they accumulate. A dose meant to help you sleep at 10 p.m. may still be impairing your coordination when you get up at 3 a.m. for a glass of water. Multiple systematic reviews confirm that benzodiazepine use is associated with a substantially increased risk of injurious falls in older adults, falls serious enough to require hospitalization. Falls are the leading cause of fatal injury in adults over 65 in the United States. We're not talking about a minor side effect. And beyond the fall risk, benzodiazepines consistently impair memory, attention, and executive function in older adults, even when people feel they've adapted to the medication. The American Geriatric Society explicitly lists the entire benzodiazepine class on the Beers criteria as drugs to avoid in older people. If you are currently prescribed Xanax, Ativan, or Valium, please do not stop taking it suddenly. Abrupt discontinuation can cause serious withdrawal, including seizures. This is a conversation to have with your doctor about a supervised, gradual taper, and I'll tell you exactly what to bring to that appointment in a few minutes. Comment below right now. Are you or someone in your family currently taking any of the medications I've mentioned or will mention? Comment on the list. I want to see how widespread this actually is. The second medication on this list genuinely shocks people because it costs $6 at any drugstore. Diphenhydramine. Sold as Benadryl for allergies and as the active sleep ingredient in ZzzQuil, Unisom, and Tylenol PM. Millions of seniors take this every single night, confident that if it's available without a prescription, it must be safe. It isn't. Not after 70. Diphenhydramine is one of the most potent anticholinergic drugs available over the counter. Anticholinergic means it blocks acetylcholine, the primary neurotransmitter your brain uses for memory and learning. Interfere with that chemical nightly for months or years, and the consequences are serious. A landmark prospective cohort study published in JAMA Internal Medicine in 2015 followed 3,434 adults aged 65 and older for over 7 years. Researchers found a clear dose-response relationship between cumulative anticholinergic drug use and dementia risk. Those in the highest use category had a 54% increased risk of developing dementia compared to non-users. The most common anticholinergic drugs in that study were first-generation antihistamines, exactly like diphenhydramine. A 2019 study published in JAMA Internal Medicine, looking at nearly 60,000 dementia patients, corroborated those findings. The evidence has continued to build every year since. Eleanor was 71 years old and had been taking 2 Benadryl tablets every night for nearly 5 years. Her doctor had actually suggested it for sleep. Over those years, her family watched her become increasingly forgetful. Repeated questions, confusion in familiar places, lost words mid-sentence. A new geriatrician reviewed her medication list and flagged the diphenhydramine immediately. Over the following 7 months after she stopped taking it under medical guidance, Eleanor's cognitive test scores stabilized and partially improved. Her daughter told me it felt like getting a piece of her mother back. The change was noticeable. The next medication is one that tens of millions of seniors reach for the moment their knees or back flare, and the kidney damage it causes develops silently, without a single symptom, until it's already advanced. Stay with me. The third medication is ibuprofen and naproxen, sold as Advil, Motrin, and Aleve. These non-steroidal anti-inflammatory drugs are the first response to pain in most households. For occasional use in younger adults, they're generally manageable. For regular use in adults over 70, the risk profile changes entirely. Your kidneys are responsible for filtering these drugs from your bloodstream. After 70, kidney function has typically declined by 40 to 50% compared to young adulthood. When ibuprofen circulates in a body with already reduced kidney function, it lingers much longer, hits much harder, and progressively damages the tissue responsible for clearing it. The 2023 update to the American Geriatric Society Beers criteria specifically reinforced the need for renal function-based dose adjustments for NSAIDs, recognizing how frequently this class causes acute kidney injury in older adults. The gastrointestinal risk is equally serious. The stomach lining becomes more fragile with age, and NSAIDs directly impair its protective barrier. According to the NIH, older adults who use NSAIDs regularly are 3 to 5 times more likely to develop a serious gastrointestinal bleed than younger users. And those bleeds are far more dangerous in someone over 70. For anyone with heart disease or high blood pressure, NSAIDs additionally raise blood pressure and increase fluid retention, elevating heart failure risk. This is the trifecta that makes ibuprofen and naproxen particularly dangerous as a daily or near-daily habit after 70. Tell me in the comments, do you currently use ibuprofen or naproxen for pain? Comment yes or no below, because I'm going to tell you what works better for senior joint pain without any of these risks. Coming up shortly, the fourth medication is prescribed to roughly 10 million Americans annually for sleep. Zolpidem, sold as Ambien. The FDA issued a specific safety communication about this drug and older adults, noting that elderly patients can have far higher blood concentrations of Zolpidem the morning after taking it compared to younger users taking the same dose. This means they're still pharmacologically sedated when they wake up, without knowing it. They feel like themselves. They don't feel drugged, but their coordination and reaction time are compromised. Research consistently finds that Zolpidem use is associated with nearly twice the risk of hip fracture in older adults. Hip fractures in adults over 70 carry a 1-year mortality rate of 20 to 30%. That means up to 3 in 10 seniors who break a hip may not survive to the following year, often due to complications like blood clots or pneumonia during recovery. And there's an additional problem. Zolpidem suppresses the deep, restorative stages of sleep while increasing lighter sleep stages. So you fall asleep faster, but you wake up less restored, which drives continued use, higher doses, and dependency. It solves nothing. It just changes the shape of the problem. The fifth medication surprises more people than any other on this list. Proton pump inhibitors. Omeprazole, Prilosec, Nexium, Prevacid. These are among the most widely prescribed drugs in the world, and for short-term use, 4 to 8 weeks, they're appropriate and effective for acid reflux and stomach ulcers. The problem is that most seniors aren't taking them for 8 weeks. They've been on them for years, sometimes decades, without any reassessment. Long-term PPI use after 70 quietly depletes 2 critical nutrients. First, vitamin B12. Your stomach acid is essential for absorbing B12 from food. Suppress that acid for years, and B12 absorption drops sharply. Research published in JAMA found that long-term PPI use was associated with a 65% higher risk of B12 deficiency. In seniors, severe B12 deficiency causes peripheral neuropathy, the tingling and numbness in hands and feet, as well as cognitive decline that mimics dementia. Second, magnesium. The FDA issued a specific safety communication warning about hypomagnesemia, meaning dangerously low magnesium, in long-term PPI users. Low magnesium affects heart rhythm and nerve signaling in ways that compound other cardiac and neurological risks in older adults. Robert was 76. He had been on omeprazole for 9 years, originally prescribed for an ulcer that had resolved long before. He'd been living with severe foot numbness and what his family called a fog he couldn't shake. His B12 came back critically low. His geriatrician tapered him off the PPI over 8 weeks, started aggressive B12 replacement therapy, and shifted his reflux management to dietary changes and a safer alternative medication. 4 months later, the neurological symptoms were clearly improving. 9 years of a prescription that was no longer necessary, caught with one thorough medication review. Here is exactly what to do after watching this. First, write down every medication you take, prescription and over-the-counter. Yes, include Benadryl, the Advil, the Prilosec. Over-the-counter does not mean safety. Second, bring that list to your doctor and ask specifically for a geriatric medication review, requesting evaluation against the American Geriatric Society Beers criteria, BEERS. Those exact words will be immediately recognized. Third, for pain, ask your doctor about acetaminophen as a first-line alternative. It is significantly safer for kidneys and the GI tract in seniors at the correct dose. No more than 3,000 milligrams total per day for adults over 65. Fourth, for sleep, ask for a referral to cognitive behavioral therapy for insomnia, known as CBTI. Studies consistently show it outperforms every sleep medication for long-term outcomes, with 0 drug interactions, 0 dependency, and no morning impairment. Fifth, if you've been on a PPI for more than 6 months, ask your doctor whether you still need it and whether your B12 level has been checked recently. A critical safety note before we close: do not stop any prescription medication without speaking to your doctor first. Benzodiazepine withdrawal without medical supervision can cause life-threatening seizures, and for anyone managing heart disease, kidney disease, or multiple prescriptions simultaneously, any medication change requires careful, coordinated medical oversight. These 5 medications are not automatically dangerous for every person in every situation, but in adults over 70, used long-term without reassessment, the research is consistent. Your body has changed since you first started taking some of these drugs. Your medication list may need to catch up. Leave a comment below with one of 3 things. Comment, reviewing my list if you're going to check your medications today. Comment your age and which of these 5 you want to ask your doctor about. Or comment, sharing this, if you're sending it to a parent or loved one who needs to see it. Please subscribe, because next week I'm covering 5 supplement combinations that are quietly dangerous for seniors, including combinations being sold together in the same bottle as if they're perfectly safe. That video could genuinely protect someone you love. I'm Dr. Sarah Mitchell. Stay informed and take care.